more flu-associated deaths to our dashboard this week. So we are now up to a total of 362 deaths from influenza that are reported on our flu dashboard, with 2 of those being deaths in children. And that means that given where we are in the flu season, we are on track to probably exceed the highest number of flu-associated deaths that have been reported in North Carolina since we started tracking all flu deaths during 2009 in the H1N1 pandemic. So although we do believe that activity peaked, being at the peak really means you're kind of halfway there. What goes up must come down. So we still do know that there's going to be a lot more flu out there. And unfortunately, that also includes more severe cases that we expect to see here in North Carolina. So we basically wanted to share where we are and what information we have about flu, and also share some of our messages for people to help keep themselves safe and healthy. The first one being that it's not too late to get your flu vaccine if you haven't done that already. Although we do think activity has peaked, there's still going to be quite a bit of flu. We have a long ways to go down. So there's going to be quite a bit of flu around in North Carolina for several weeks to come. We also have not seen much flu B, which is one of the types of flu virus we see every year. We haven't seen much of that yet. Oftentimes we will get a later season spike in influenza B. So we are encouraging people for those reasons to go ahead and get those annual flu shots if they haven't done it already. That's the best way that you can prevent severe illness, hospitalizations, and even deaths. And we also wanted to encourage people that if you are sick and you think you might have the flu, it's important to contact your doctor right away, particularly if you're someone who might be at higher risk, and that's people over 65, young children, people with certain medical conditions like heart or lung disease. There are antiviral treatments that your doctor can prescribe that can make a big difference between just a very unpleasant illness and something more severe. So if you do think you might have the flu, we're encouraging you to contact your doctor and find out if you might need antiviral treatment for that. And then, of course, we want people to remember those basic prevention measures, including good hand washing with soap and water, making sure that you, if you are sick, you're staying home from school, staying home from work to avoid spreading flu to others, covering your coughs and sneezes, and making sure to clean and disinfect doorknobs and other frequently touched surfaces. So that's just some basic information. And with that, I will stop and we can open it up for questions.
Thanks, Dr. Moore. And just as a reminder, we'll be taking questions in the chat as well as if you raise your hand. So let's start with the ones we've got in the chat. We have one from Lynn Bonner. Why are there so many more deaths this year? Is it the strain? And are people not being immunized?
That is the million-dollar question. And I don't know that there's one right answer as to why the season has been more severe. CDC has categorized this season based on data so far as high severity. This is the first time since the 2017-18 season that we've had a high severity flu season. And the reasons why one season is more severe than another are complex and honestly not that well understood. So, it can have to do with the specific viruses that are going around. It can also have to do with the level of immunity out there in the population. We have seen less flu vaccination this year compared to previous years. We had, last I saw, less than 50% of the population had received a flu vaccine. And then we also know that, we had some milder seasons, less flu going around during the peak years of the COVID pandemic. So some of that immunity that people had from those sort of quote unquote normal seasonal flu exposures that may have dipped down, leading to more susceptibility in the population. But really, the reasons why one season is more severe than another are not well understood.
And our next question from Rose Hoban with NC Health News. Are we tracking which strain of flu is causing the most deaths, and how well do the viruses line up with what's in this year's shot?
Yeah, I don't have information about the flu strains specifically for the people who died from flu in North Carolina. I can say overall what we've seen this season is almost all influenza A, not much influenza B. And then for those who are familiar with flu, we usually have two different influenza A types going around. Influenza A H1, which is the 2009 pandemic virus that's still with us, and then influenza A H3, which is another common type of flu A. It's been really about 50-50 for those two types of flu A this year, which is somewhat unusual. Usually we see one particular flu A predominating, and this year it's been a mix. In terms of how well those strains are matched to what's covered by the vaccine, the preliminary information from CDC so far this season shows that the influenza A H1 viruses going around are overall very well matched to the influenza A component, H1 component of the vaccine. The influenza A H3 viruses going around are less well matched to the A H3 that's covered by the vaccine. But how well they're covered or how well they match to the vaccine is one of several factors that can influence how protective the vaccines are. And this isn't exactly your question, but we do have some preliminary information about flu vaccine effectiveness this season that shows that it's roughly in line with what we generally see, which is generally an overall effectiveness of about 50%. So that might not sound great, when we think about something like measles vaccine that's 97% effective if you have 2 doses. But what a 50% effectiveness really means is that you're cutting your risk in half. So it's still a very highly effective vaccine, even if it's not in the range that we have come to expect from some of our other types of vaccination.
Thank you.
So, Rose, that may have been more than you were asking.
And from WITN, which communities or age groups are being more affected by the flu virus this time around?
Yeah, so the groups that we've seen most impacted this year are particularly our older residents. And when we look at our flu deaths in particular, about 75% of the deaths have been in people who are 65 and older. And that's a group that we know is at higher risk for severe complications, severe illness from influenza. We have had, as I mentioned, 2 deaths in children, which is tragic. We've not, last year, for some context, we had our highest number of flu deaths in children. We had 16 deaths in children last year. This year, we have not seen that numbers that high, fortunately. So the groups where we're seeing the biggest impact this year are our older residents.
Thank you. And from Rose, is there a part of the state that's more affected than others? In other words, are there more concentrations of illnesses or deaths?
The short answer is not really. We tend to see flu activity, once it sort of starts going up, it spreads pretty quickly across the state. So we do have some breakdowns by region on our NCDHHS dashboard that you can look at, but overall, we're not seeing any big differences regionally across the state in terms of flu activity or flu deaths.
And from Sean, how does this year's strain compare to years past in terms of severity and number of deaths and overall cases?
So as I mentioned, we're seeing a couple different strains this year. We have sort of an even split with our influenza A between the AH3 and the AH1, which are just the two common seasonal influenza A viruses. We are seeing a more severe season than we have seen certainly since the COVID pandemic began. CDC categorizes this season as being high severity, and the last time there was a high severity season was back in 2017, 2018 season. So we are seeing both in North Carolina and across the country higher severity and more deaths than we've seen in recent years.
Thank you. And from Carly Haynes, how are NC hospitals handling this uptick? Are hospital beds in shorter supply?
Well, it depends on the hospital and the hospital system. So, I would encourage you to reach out to particular hospitals or healthcare systems with those questions. We know that they have many of them are running very high patient census numbers. I guess to the extent that there is saving grace here, we have not seen as much COVID activity this winter as we had in recent seasons. So that's very helpful in terms of our capacity of our healthcare systems to take care of patients.
Thank you. And I think we touched on this a little bit earlier, but is this a matter of more cases and therefore more deaths, or more deaths in proportion to the cases we typically see year to year?
Yeah, great question. And it's the former. So it's really a matter of we're seeing more flu cases rather than we're seeing a higher fatality rate among the flu cases. So, as I mentioned, we appear to have hit the peak probably early February. So we still have a long ways to go in this season. But as of where we were a week or two ago, CDC had estimated about 37 million infections and about 21,000 deaths had occurred. So, when we look at the quote unquote normal ranges for seasonal flu, it can be anywhere from 9 million cases up to 41 million cases of infections per year. And when we look at deaths, it's somewhere in the tens of thousands, ranging up to over 50,000 deaths for again, a quote unquote normal flu season. So far this year, we're not in that territory, but we know we're not anywhere near done with this year's flu season.
Thanks, Dr. Moore. And from Rose Hoban, are you getting the information that you need from the CDC this year?
Yes, we did have some pause in the flu surveillance information that was being posted by CDC, and that fortunately has been resumed now. So if you go on the CDC website, we are now able to see the data that they share, which includes the surveillance data that they get from North Carolina and from other states about numbers of hospitalizations and numbers of deaths. CDC also operates networks across the country that look at flu vaccine effectiveness every year. So we are able to see the sort of mid-season early data from those networks also, which is very helpful for us to be able to understand how effective the vaccines are and communicate with the public.
And from Charles Petty with Spectrum News, what types of medications will your doctor normally prescribe if needed? And is it spreading higher in spaces such as college campuses, childcare centers, and nursing homes, or is the spread of flu more evenly impacted across the population?
Yeah. So for the first question, there are specific drugs, antiviral drugs that are prescription drugs to treat influenza. One of them is called oseltamivir. That's the most common one. Also called Tamiflu. That's the brand name. So that's if you do have flu, and particularly if you are at higher risk, those are the drugs that your doctor might prescribe that, again, can make a big difference between just a very unpleasant illness and hospitalization or something more severe. And then in terms of where we're seeing the biggest impacts. Again, we're seeing a lot of the impact in our older population this year, and that does include a lot of outbreaks in our long-term care facilities, adult care homes, nursing facilities, those types of settings. So that is a place where we know, unfortunately, more people who are vulnerable to severe infections live in close quarters and the settings that are vulnerable to flu outbreaks. And we've certainly seen that this year.
Thank you. And for Marcel Francis, how effective have vaccinations been in mitigating cases of influenza, RSV, and COVID-19 this season? And do we expect another spike in respiratory illnesses later on in the season?
So in terms of flu vaccine, as I mentioned, the early data that we have on flu vaccine effectiveness has shown that it's in about the same range that we've normally seen over the past several seasons. It's varies depending on the age group you're looking at and the particular flu strain that you're looking at. But overall, it's going to reduce your risk by about half. So that's still a highly effective strategy for preventing you or your loved ones from getting sick or from having severe complications related to flu. And we do have, of course, safe and effective vaccines available for COVID and for RSV as well. I don't have any new or updated information on vaccine effectiveness for either of those, but those are also tools that are available. Although at this point we've seen RSV has gone down, we're coming out of that RSV season, fortunately. So RSV vaccines are not indicated for most people at this time of year. And then I think the other part of the question was if we expect to see another spike of respiratory illness, and I hope not. As I mentioned, we haven't seen a lot of influenza B, and we do sometimes see a later season spike in flu cases from influenza B. So that's certainly something that we're watching for. But hopefully the peak that we saw, again, likely around the first part of February, will be the worst of it.
All right, so those are all the questions I see in the chat, and I don't see any hands raised. Does anyone else have any questions?
I do have one question for you, Dr. Moore. Just for people who may be fearing of getting a case of maybe the flu or another respiratory illness, what measures or precautions can they take, to increase their chances of not contacting any illnesses? Of course, you have to get your flu shot, but what are some other things that people may not be thinking about?
Yeah, well, you're exactly right. Getting your flu vaccine and also your COVID vaccine is the best way to prevent respiratory illness. But whether you've gotten the vaccines or not, it's important to take those other kind of basic steps to stay healthy. I mentioned regular hand washing. Oftentimes, the way people get infected is from picking up viruses and touching their face and getting infected in that way. Soap and water or alcohol-based hand sanitizers are important. People, certainly have the option to mask if they're going to be in a crowded place, particularly during times when they know there's a lot of respiratory viruses circulating. Is another strategy to reduce the likelihood of getting infected. And then, of course, we rely on each other. If you are sick, to take steps to make sure that you're not sharing that with other people. So if you're sick, staying home from school, staying home from work, making sure you're covering your coughs and sneezes so that we can reduce circulation as much as possible.
Thank you. Appreciate it.
And from Rose in the chat, are you worried about bird flu?
Yes. I should be clear what we're seeing with this seasonal influenza with influenza this season is not caused by bird flu infections. These are quote unquote normal seasonal flu viruses that are causing this severe flu season. But we are watching closely what's happening with bird flu as well. That continues to spread very widely in our wild bird populations, and we've had spillover into our poultry and a lot of other animals. Nationally, we're now up to 70 human cases. So that's something that we're watching very closely, and we have systems in place to make sure that we would be able to pick up any infections in people. Fortunately, we have not in North Carolina had any bird flu infections identified in people, but it's something that we're continuing to watch very closely.
Thank you. And from Delaney Tarpley in the chat, at what point should a person take themselves to the doctor, and at what point should someone take themselves to the hospital if they have the flu?
Well, if you think you might have the flu, I would encourage you to contact your doctor if you have a doctor or healthcare provider that you can reach out to. Earlier is better. The medications to treat flu are most effective if they're started soon after the symptoms have started. So I would encourage people, particularly if you're over 65, if you have heart disease, any kind of lung disease, asthma, COPD, I would encourage you to call right away when you start feeling bad and think you might have the flu, just to find out if you might need to get tested and possibly need to get treatment.
Thank you. And I'll give it another minute if anyone else has any other questions. But if this concludes the question portion, I thank you all for your time.
Thank you.
All right. Thanks, everyone. Have a good rest of your day. And if anyone has any other questions, you can send us an email to our news account, and I will drop that in the chat. All right. Have a good week.